In April 1961, the 6th Soviet Antarctic expedition took a terrifying turn. Dr. Leonid Rogozov, the only doctor on the team, started feeling weak and feverish, with sharp pain in his right side. After a few days, it was clear that he had appendicitis, an infection that could cause his appendix to burst. Outside, a blizzard was raging, making it dangerous for anyone to travel to the station or for him to leave. So Rogozov was faced with a difficult choice: wait for help that might never arrive or perform surgery on himself to remove his appendix. While his situation was extreme, appendicitis is not uncommon. It affects about 1 in 12 people. But what causes appendicitis, and why is the appendix so prone to bursting? The appendix is a small, worm-shaped pouch attached to the large intestine, home to a variety of gut bacteria. For a long time, scientists thought the appendix was a useless relic from evolution. However, recent studies show that the appendix evolved independently in many mammals, suggesting it may have some function, perhaps as a reserve for healthy gut bacteria or a role in the immune system. Despite these possible functions, the appendix can cause serious problems. Most cases of appendicitis begin with some kind of obstruction. For example, a small piece of stool, called an appendicolith, can get stuck at the entrance of the appendix. Other times, infections from viruses or parasites can trigger the immune system, causing inflammation. This immune response can also be triggered by the bacteria that naturally live in the gut. As a result, nearby lymph nodes swell and block the appendix's opening. Since the appendix is a closed pouch, pressure builds up inside. This creates a perfect environment for bacteria to grow and multiply. As the inflamed appendix swells, pain starts to set in. This pain is different from a regular stomach ache. It usually begins near the belly button, then moves to the lower right abdomen and gets worse. If left untreated, the appendix can continue to expand, cutting off blood flow and weakening its walls. Eventually, it can burst, causing the infection to spread throughout the abdomen, which can be fatal. Fortunately, not all cases of appendicitis lead to a rupture, but it's impossible to predict exactly when or if the appendix will burst just from the symptoms. Therefore, it's important for anyone with severe abdominal pain to seek immediate medical attention. Since doctors first identified appendicitis in the late 1800s, an appendectomy, removal of the appendix, has been the standard treatment. It's typically done within 24 hours of diagnosis. The inflamed appendix is removed either through one large incision or several smaller ones using a camera and small tools. Recovery is usually quick, and most patients are discharged within a day or two. However, if the appendix has burst, the surgery is more complicated, as doctors need to clean any bacteria and pus from the abdominal cavity. Living without an appendix usually doesn't cause long-term health issues. Thanks to modern medicine, many patients can avoid surgery altogether. Appendicitis is sometimes treated successfully with a course of antibiotics, which can be started in the emergency room and continued at home. While most people now receive much less distressing treatment, Dr. Rogozov's story stands out. After giving himself local anesthesia, he removed his own appendix, stitched himself up, and was back to his regular duties just 2 weeks later. Because of his experience, doctors working in remote stations like Antarctica now make sure to bring plenty of antibiotics in case they need to treat appendicitis. Thanks for watching this video. If you liked it and want to continue learning more about topics like this, subscribe to the channel and activate the bell so you don't miss the next videos.